A 27-year-old man is admitted to the kidney ward of a hospital in central Brazil, and the first thing the doctors notice is his face. The right side of it doesn't move. When he tries to speak, only half of his mouth follows the instruction. He's been vomiting over and over. He's lost weight he didn't want to lose. And he's short of breath, with a dry cough that won't quit, and the hearing in his left ear has dropped off. For the past 18 months, a machine has been doing the work his kidneys stopped doing. He is 27 years old. The blood work comes back with a number that stops the room. His calcium is 12.62 milligrams per deciliter. Normal tops out around 10.6. And when the team pulls his old records, they find that a year and a half earlier it had been 15.94, which is the kind of calcium level that can stop a heart. His creatinine, the number that tells you how well the kidneys are filtering, is 8.8. In a healthy young man it sits around 1. So they examine him, and under his skin, over his chest, over his shoulders, running down his upper arms, there are nodules, a lot of them. Hard, warm, dense little lumps sitting in the tissue over muscles that look enormous and feel wrong. Some of them are outright calcified. You can feel bone-hard deposits in places where a person should be soft. Because for years, this man had been injecting oil directly into those muscles, mineral oil, and an oily veterinary product meant for livestock, loaded with vitamins A, D, and E, into the biceps, the triceps, the back, the chest. He had stopped 2 years before this admission. 2 years is a long time to stop something and still be getting sicker from it. And nothing he injected ever went anywhere near his kidneys, not once. The oil went into the arms and the chest, and it stayed in the arms and the chest, and it is still sitting there. Yet the CT scan of his abdomen shows one kidney shrunken and wasted, the other backed up and swollen, and both of them shot through with calcium. His head, CT, shows calcium in the lining of his brain. Calcium in the bone around his inner ear, on both sides. Calcium sitting along the path of the nerve that drives his face, which his own doctors named as the reason half of it had stopped moving. And given where those deposits landed, the hearing he lost on the left almost certainly went for the same reason. There is calcium in his eyeballs. How does oil in an arm turn into stone in an eye? That's a real question with a real answer, and it took the medical world a surprisingly long time to arrive at it. The lumps and the scarring were described more than a century ago. What nobody connected until recently is that the trouble doesn't stay in the muscle. Let me back up. The idea of injecting oil into the human body to change its shape is not new, and it is not a bodybuilding invention. It goes back to the 1890s, when physicians were injecting paraffin under the skin to smooth out wrinkles and to enlarge breasts. It went badly then too. Badly enough that medicine ended up needing a word for the hard lumps it left behind, paraffinoma. And that word is still in the textbooks. But the practice never fully died. It just kept finding new customers. In 1996, it found weightlifters. A product called Synthol arrived, marketed as a site enhancement oil, and the pitch was simple and very seductive. Genetics gave you a short biceps. Training can make a muscle stronger and thicker, but it cannot change where the muscle attaches or what shape it is. Synthol could. You inject it into the belly of the muscle, and the muscle gets bigger. Immediately. No waiting. What's in it explains a lot of what follows. Roughly 85% of it is oil, medium-chain triglycerides. Then about 7.5% lidocaine, a numbing agent, so that the injection doesn't hurt the way it should hurt, and about 7.5% alcohol. That's the whole recipe. People treat it like a drug, but it doesn't build anything. It's just a filler. And whatever the thinking was behind putting an anesthetic in the bottle, the practical effect is that the body's clearest warning signal, pain, gets switched off at exactly the moment it would be most useful. And it's only one option in a whole informal pharmacy. Men have injected paraffin oil, mineral oil, sesame oil, walnut oil. In Brazil, oily veterinary supplements meant for livestock. Whatever the gym happens to be using that year. The other number that matters is volume. Danish researchers who followed a group of 88 men doing this found that the average total amount injected was 1,080 milliliters. That's over a liter of oil put into a human arm and shoulder over a period of years, a syringe at a time. And that study found something somebody had to actually go and prove. The men who pushed past a liter had significantly worse calcium levels than the men who didn't. One man on record in the literature reached an estimated 4,000 milliliters. 4 liters. We are going to come back to him. Your muscle is not a container. It is packed tissue. There's nowhere for that to go. So what actually happens when it goes in? The first thing is that nothing happens, which is exactly the problem. The arm swells and looks impressive, and there's very little pain because of the lidocaine. And for weeks or months, it seems like the trick worked. Underneath, your immune system has noticed. It sends in macrophages, the cleanup cells, the ones that swallow anything that isn't supposed to be there and digest it. Macrophages are very good at bacteria. They are useless against a droplet of paraffin. Human biochemistry has almost nothing that will break it down. So the cells do what they do when they meet something indestructible. They surround it. They pile up around the droplet, they fuse together into giant cells, and they build a wall. That wall is called a granuloma. It's the same structure your body builds around a splinter it can't push out, or around tuberculosis bacteria it can't kill. Contain what you can't destroy. Now do that around 1,000 droplets, scattered through a muscle, for years. Under a microscope, the pathologists have a name for what the tissue looks like: Swiss cheese. Holes where the oil sits, ringed by inflamed scar, with the real muscle fibers crushed out of the way and left to die in between. A German orthopedic team published the case of a 29-year-old lifter who came in 5 years after his injections with an arm that had gone rigid and painful and visibly deformed. The MRI showed oil pooled in cysts scattered all through the biceps. They had to cut the affected muscle out of his arm. Another surgical group reported a 45-year-old man whose chest had been infected over and over, the skin red and thickened and hard, needing antibiotics again and again until the fibrous mass had to be removed under general anesthetic. And one group described a man in his 30s who'd had his injections 8 to 10 years earlier, who then developed testicular cancer and started chemotherapy. The chemotherapy woke the old injection sites up. Tissue that had been quiet for years turned acutely, savagely painful. Steroids settled it. But the trigger had come out of nowhere, from a treatment aimed at something else entirely. None of this is reversible. The oil never leaves. Once it's in the muscle, it is a permanent resident, and the tissue around it never goes back to being muscle again. But all of that is local. Painful and disfiguring, yes, but local. The arm is the arm. Except the men in these reports don't usually show up at a hospital because of their arms. They show up because of a kidney stone. That's the pattern that finally made someone look closely. A man in his late 20s or 30s, fit, no medical history worth mentioning, doubled over with the worst pain of his life, passing a stone. It gets treated. Nobody asks about his shoulders. Then he's back a year later with another one. Then he's tired all the time. He's nauseated. He's vomiting in the mornings. He's constipated. He's drinking water constantly and still thirsty. He aches in his bones. And he's become depressed and foggy in a way his family notices before he does. That whole list, every symptom in it, is what a high blood calcium level does to a person. Calcium is the signal your body uses to make muscles contract and nerves fire, and your heart keep time. When there's too much of it circulating, the nerves get sluggish, the gut slows to a crawl, the muscles go weak, the mood flattens out, and the kidneys are ordered to dump the excess into the urine, which is why the person is always thirsty and always in the bathroom, and why the stones keep forming. Old textbooks summarized it as stones, bones, moans, and groans, which sounds almost comic until you meet somebody living it. That is close to the record of the man in Brazil. In the 4 years before the admission we started with, he was in and out of hospital, with stone attacks, urinary infections, a blocked ureter, and a stent placed to keep it open. 4 years of being treated, correctly and competently, for the thing that was happening rather than the thing that was causing it. And the numbers say he was not unusual. In that Danish group of 88 men, more than a third had a history of kidney stones. Among the men whose calcium chemistry had already gone abnormal, it was closer to half. The Danish group also found something important when they went looking early. Before the blood calcium is even abnormal, before anyone would think anything was wrong, these men are already spilling excessive calcium into their urine. The kidney is compensating. Quietly, and for years, it's taking the hit. Hey, quick pause. If you've picked up something useful in the last few minutes and you're not subscribed, I'd really appreciate it if you hit that button. I read the comments on every single one, and the next case is already in research. Thanks for being here. Alright, so a young man with kidney stones and high calcium walks into an emergency department. Their reasoning from here is genuinely good, and it still takes them to the wrong place. High calcium in an adult almost always means one of two things. Either a parathyroid gland has gone rogue and is pumping out parathyroid hormone, which pulls calcium out of the bones, or there's a cancer somewhere driving the level up. Those two account for around 90% of everything, so you check the parathyroid hormone first. And in these men, it's low. Suppressed. Right down at the floor of the range or below it. That's actually reassuring in one narrow sense. It means the parathyroid glands are behaving perfectly. They can see the high calcium, and they've shut themselves off, exactly as designed. Which rules out the most common cause and moves cancer to the top of the list. So the hunt starts. Scan of the parathyroids, a bone scan looking for tumor deposits, CT of the chest and abdomen, protein studies in the blood, and urine hunting for myeloma. In several of the published cases, they went as far as full-body PET scans. The papers record these as lists of negative results, one line each, which understates things considerably. Follow the order of those investigations and the time courses around them, and it's clear that some of these patients spent weeks, in places, months, living inside a cancer hunt that kept not finding a cancer. Every test comes back clean. No tumor. Anywhere. And then somebody orders the PET scan, and the PET scan is where the story cracks open. A PET scan lights up tissue that is burning glucose hard, which is what tumors do, and it's also what furiously active immune cells do. In the Brazilian man, the whole scan lit up. Both glutes. Both biceps, both triceps. The deltoids, the pecs, the traps, the lats. It lit up the muscle groups he had been injecting, and then some. The tissue wasn't cancer. The tissue was thousands of granulomas, still angry, years after the oil went in. And they had not been sitting there quietly. They had been manufacturing a hormone. To see why that matters, you need one piece of ordinary physiology. Vitamin D, the kind you make in sunlight or swallow in a capsule, is inactive. It's raw material. Your liver converts it into a storage form, and then your kidney performs the final step, switching it into the active hormone, calcitriol, using an enzyme called 1-alpha-hydroxylase. Calcitriol's job is to walk down to your intestine and tell it to absorb calcium from your food. The whole thing is on a tight leash. Your kidney makes calcitriol chiefly when the parathyroid hormone tells it to. Calcium climbs. Parathyroid hormone drops. The kidney stops making calcitriol. Absorption slows down. Calcium comes back to normal. It's a thermostat, and it's a good one. Macrophages inside a granuloma can make that same enzyme, and they are not connected to the thermostat. Danish researchers proved it in the most direct way possible. They surgically removed granuloma tissue from 3 of these men, kept it alive in the laboratory, and measured what it produced. The gene for that activating enzyme was more strongly expressed in the granuloma tissue than in actual human kidney tissue. And the lumps of tissue in the dish poured out active vitamin D hormone at 40 to 50% of the rate of real, functioning human kidney tissue. All 3 men, though, were on high-dose steroids when that tissue was taken out of them. That was the output while the brakes were on. Take those figures at face value, and the picture they point to is a strange one. Roughly speaking, these men are carrying a second, unofficial hormone gland in their arms and their chest. It has no off switch, no feedback loop, and no interest whatsoever in what the calcium level is doing. The same study found that the disposal enzyme, the one that normally breaks calcitriol back down and clears it, tended to run lower in the granuloma than in kidney tissue, more being made, less being cleared away. Around the clock, for as long as the oil is in there, which is forever. His intestine, meanwhile, is just following orders. It absorbs calcium out of every meal, as though the body were desperate for it. His parathyroid glands scream stop, and nobody is listening, because the signal isn't coming from the parathyroids anymore, and all of that calcium has to leave through the kidney. This is the part that answers the question I opened with. The kidney filters the blood, and to make urine it has to concentrate what it filters, which means the fluid inside those microscopic tubes gets more and more saturated as it travels. Push year after year of excess calcium through that system, and eventually the calcium comes out of solution and crystallizes, right there inside the tubes and in the tissue around them. Stones, in the collecting system. And in the kidney tissue itself, a fine, gritty mineral deposit throughout the organ. Nephrocalcinosis, literally kidney calcification. Crystals in tissue cause inflammation. Inflammation in the kidney causes scarring. The tubules atrophy and the spaces between them fill in with fibrous tissue. This isn't the kind of injury that heals. It's the kidney being slowly replaced with scar, from the inside out. The 27-year-old's records show the whole slide. A year and a half before his admission, creatinine 12.3, wildly abnormal. Then calcium 15.94. Then dialysis. By the time he was in front of that nephrology team, his left kidney had shriveled and his right was obstructed and swollen, and the 25 vitamin D in his blood, the active hormone, was 138, where the top of normal is about 79. His storage vitamin D, the raw material, was unremarkable, sitting low in the normal range, ordinary supply. Active hormone running at nearly double the ceiling. That mismatch is the fingerprint of a granuloma, and it is the reason a diagnosis is possible at all. One thing his doctors were careful about, and I want to be careful about it too. Oil wasn't the only thing he'd been putting in his body. He had used anabolic steroids for years, several of them, which can damage kidneys directly. He had used cocaine. And the veterinary product he was injecting carried very high doses of vitamin A, which can raise calcium in its own right. His medical team wrote plainly that the mechanisms behind his kidney failure were probably multiple, layered on top of each other, with some mattering more than others. The granulomas explain the pattern of his calcium beautifully. They are not the only thing that had been happening to those kidneys. And here the story gets bigger than bodybuilding, which surprised me when I went looking. In 2018, a group pulled together every case in the medical literature of high calcium following a cosmetic injection of any material, 23 people. And they were mostly not men in gyms. The average age was about 50. Nearly 4 in 5 were women. The most common substance was silicone, then an acrylic filler, with paraffin oil accounting for only 2 of the 23. The most common site was the buttock, then the breast. Same biology, completely different rooms. A woman getting filler injected into her buttocks and a man injecting oil into his biceps are, as far as the calcium is concerned, doing the same thing. In that group of 23, kidney failure was the most common complication, in 82% of them, and 2 people died. The average gap between the injection and the day somebody worked out why the calcium was high was just under 8 years. 8 years is the whole cruelty of this. It's long enough that a man in his mid-30s has genuinely stopped thinking about something he did in his 20s. Long enough that he's not connecting it to the exhaustion, or the kidney stones, or the fog that's been settling over him for a year. And long enough that when a doctor asks whether he's ever had anything injected, the honest answer in his head is no, because he's thinking about medicine, and what happened in a locker room 10 years ago doesn't feel like it belongs in the same category. That last part is my reading of the gap, rather than something anyone measured. But it's the reading the authors themselves seem to have reached, because more than one of these papers ends with the same instruction to doctors. When you take a history, ask about cosmetic injections specifically, and do not let the answer go by. And the calcium doesn't stop at the kidneys. Blood can only hold so much calcium and phosphate dissolved at once. The 2 numbers multiply together, and past a certain product, the chemistry gives out, and the mineral precipitates wherever it happens to be. This is where the failing kidney turns on its owner. A working kidney dumps surplus phosphate. His couldn't. So his phosphate climbed too, well above normal. At the same time his calcium was high, and the product of the 2 went through the roof. Mineral came out of solution into tissue that had done nothing wrong and had no business turning to stone. Doctors call it metastatic calcification, borrowing the word for the way it shows up in scattered, distant places. Which is how you get a 27-year-old whose CT shows calcium in the membranes wrapping his brain, in the bone around his cochlea, along the path of his facial nerve, the one that cost him half his expression, and in the whites of his eyes. And in 2024, Danish forensic pathologists published something no one had been able to publish before. A man in his 30s. That 4-liter figure from earlier belongs to him. Over the 8 years before he died, He had put an estimated 4,000 milliliters of paraffin oil into his biceps, his triceps, and his deltoids, both arms. He'd used anabolic steroids before that and had given those up entirely. He had been through the whole sequence: granulomas, high calcium, kidneys destroyed, dialysis 3 times a week. Then he died, and his body went to the medical examiner. The external examination found his arms grossly enlarged and ulcerated. The post-mortem CT found calcification in his ligaments, in his heart, in his kidneys, in the tough membrane over his brain. The microscope found mineral laid down through his lungs, his heart muscle, his kidneys, tissue after tissue. They named cardiac arrest as the cause, with the calcium deposits in his heart as the driver and his failed kidneys as a contributing factor, and they were careful about the limits of that. Sudden cardiac death is common in people on dialysis for any reason at all, and some researchers think the usual mechanism there is a disturbed heart rhythm from shifting salts rather than anything structural. So, the calcium in his heart muscle is the best explanation on the table rather than a closed case. What the authors did claim, and it's a narrower claim than it first sounds, is that this was the first death in the medical literature they could find traced directly to cosmetic oil injection and what follows it. Not the first person to die after doing this. You'll remember, 2 people had already died in that group of 23, and the Danish team read those as kidney complications. This was the first one anybody had followed the whole way through, from the syringe in a gym to the slides on a pathologist's bench. So can any of it be treated? Some of it, yes. And the logic of the treatment is beautiful, even though the outcome usually isn't. The obvious move for high calcium is a bisphosphonate, a drug that stops bone from releasing calcium into the blood. In these men it works, but poorly, and far less well than the alternative. Once you understand the mechanism, you can see why before anyone tries it. Their bones are innocent. The calcium is coming from the dinner table, absorbed by an intestine, taking orders from a hormone made in the arms. What does work is steroids: prednisone, prednisolone, hydrocortisone. Steroids shut down the macrophages inside the granulomas, and if you quiet the macrophages, you turn off the factory. Calcium levels fall over days. In several reported cases, kidney function improved as the calcium came down. The Danish laboratory tested this directly on that living granuloma tissue and found that a steroid, an antifungal drug that blocks the activating enzyme directly, and an immune suppressant all cut the hormone production right down in the dish. That's why there's interest in them, and why the Danish team has been arguing for proper trials. Steroids taken for years carry their own long list of costs, and these are men in their 30s who may need them indefinitely. The same group made one further argument that I think is the most useful thing in the whole literature. Don't wait for the calcium to go high. If a man has been injecting oil and his urine is already loaded with calcium, or he's already passed a stone, that is the moment to treat him, because by the time the blood level is abnormal, the kidney has been absorbing the damage for years. But the granulomas are still there, so the moment the treatment stops or slips, the factory starts back up. Danish physicians described a 39-year-old who responded well to prednisolone and then relapsed the following summer, and again the summer after that, most likely because he'd been taking a vitamin D supplement and spending time in the sun. Sunshine. The most ordinary thing in the world, and it was feeding raw material straight to the thing in his arms. Surgery sounds like the answer. Cut the granulomas out and the problem leaves with them. It has been tried. In that review of 23 people, surgery was attempted twice, and both times it failed, because there was far too much tissue involved to remove. In the Brazilian case, the lesions were spread through so many muscle groups that his team judged surgery impossible and dangerous to attempt. And none of it gives him his kidneys back. Scar is scar. He left that hospital with end-stage kidney disease, and end-stage means what it says. There's one more part of that case report that I keep coming back to, and it's the part I think the authors were most thoughtful about. Alongside the dialysis, the hydrocortisone, and the intravenous drug for his calcium, the team brought in psychiatry, and he was started on treatment for body dysmorphic disorder. Because a person does not put a liter of veterinary oil into his own arms because he lacks information. He does it because of how he sees himself in a mirror, and no amount of dialysis touches that. His doctors put it in print, in the discussion section of a medical journal. Physicians have to take the psychiatric side seriously, because otherwise the treatment won't be followed, which is a more humane sentence than you usually find in a case report, and a more realistic one. He was 27. He had been chasing a shape. If there's something to carry out of this, it's smaller and more general than the story. Anything injected into the body that the body cannot break down does not stay a local decision. It becomes a permanent tenant with its own biology, and the reckoning can arrive a decade later wearing a completely different disguise, as a kidney stone, or a bad mood, or a face that stopped working. So if you or somebody close to you has ever had any material injected for cosmetic reasons, whatever it was, whenever it was, and however far in the past it feels, that belongs in your medical history. Say it out loud at the appointment. It costs you one sentence, and it may be the single clue that stops a doctor searching in the wrong place for years. And if you're ever told your calcium is high and nobody can explain why, that's a question worth staying loud about with your own physician until somebody finds the answer. Thanks for spending this time with me. Look after yourselves out there.